Tennis elbow is a common cause of elbow pain, and for most people, it resolves with fairly standard treatments. But for those people who are struggling to recover from tennis elbow, would peptides or regenerative treatments like PRP or exosomes or stem cells help you heal? My name is Dr. David Geier, triple board certified orthopedic surgeon, sports medicine specialist, and anti-aging and regenerative medicine expert. I help you feel, look, and perform your best regardless of age or injury. Now, I'm not going to get too much into the specifics of what tennis elbow is. I've got a number of videos on tennis elbow, but this is pain on the outside or the lateral side of the elbow because of a small area of degeneration within one of the tendons that extends your wrist and extends your finger. It's not an inflammation, despite the fact that its technical term is lateral epicondylitis. And that's one of the thoughts as to why cortisone shots, yes, they might make you feel better, but they've been shown to have a significantly higher rate of recurrence and potentially failure of recovery and ending in the need for surgery. And so that's where there's been a lot of thought, would regenerative treatments be helpful? Now, PRP is the standard one that has been used over the last, let's say, 5 to 10 years with some good success rates. But I'm going to talk about some other ideas in this video. I'll talk a little bit about PRP as well. First of all, please know that when we're talking about regenerative treatments, whether it's exosomes or stem cells or PRP even, or peptides, we're talking about largely experimental treatments in terms of the FDA and the insurance companies. I'm not pushing them by any means. This is not medical advice. I'm just putting the information out there for people who are looking for information on other ideas. Also, when I talk about any of this, I have got other videos on potentially where to get some of these treatments and things like that. I'm not promoting any of that. So definitely check out other videos in my channel and in the modern medicine playlist, and you'll see sort of my thoughts on that. Now, as far as why some of these regenerative treatments might be beneficial, again, it's because it's a small area of degeneration within that extensor tendon, and you have to try to get that to heal. And if rest and a counterforce brace don't necessarily help, then you start to think about regenerative treatments. Again, I don't know that cortisone is necessarily the way to go, and that's been shown in a number of studies. As far as the one that I get asked about, and the question I got led to this video, was somebody asking me, would peptides like BPC 157 or thymosin beta 4 be helpful? Now, those peptides have, to my knowledge, not been studied for tennis elbow in humans. I don't know that that type of thing, that extensor tendon, has been studied even in animals. But there are studies, specifically the Achilles tendon, where those, especially BPC 157, have been used with success to help tendons heal. So a subcutaneous injection of BPC, for instance, near the site of the tennis elbow pain on a daily basis very likely might help that tendon heal more appropriately, more quickly, and get somebody back to normal. There's less data with thymosin beta 4 or TB4 or TB500, but potentially that may play a role. As far as something like CJC 1295, maybe that would strengthen the muscles in the area, take pressure off that healing tendon. Potentially there could be a role. Again, they're considered experimental. I'm not saying they're definitely something you should do. Also not saying these are things you should just go out and look for online sites doing it. I've got definite thoughts about that, so check those out. But they could be an option for some people. Other ideas would be more regenerative treatments performed by the doctor or the orthopedic surgeon. I mentioned platelet-rich plasma, where we draw up a small amount of blood from your body, put that syringe of blood in a centrifuge, spin it for 5 to 20 minutes to get rid of the red blood cells, get rid of the white blood cells, and really concentrate the platelets within the plasma to basically deliver growth factors and other cells needed to get that tendon to heal. And that's been shown to be fairly successful. Going a step further than that is where you talk about things like stem cells or exosomes. And again, those are really being looked at more, at least in terms of orthopedics, at osteoarthritis, but there are people that feel fairly strongly that those increase the healing of tendons and ligaments even better than something like PRP. It'll be interesting to see in the coming years how the studies look for that. Again, those are considered experimental treatments, but could be an option for somebody looking to potentially avoid surgery. Now, I'd love to hear your experience with your elbow injury, so leave those in the comments below. Just understand, if you leave a question in the comments, I can't offer you medical advice, but like I did here, I might answer that question in a future video. Make sure to subscribe to this channel and click the bell to be notified when I release a new video and when I start my monthly Ask Dr. Geier live shows. Thank you for watching. I look forward to helping you feel, look, and perform better than ever.